Hello? Yeah, you can see my screen visible, no? One second. During the okay. If they have any question answer, they will be presenting. We will be addressing at the last, no? Yeah. Yeah, yeah. Fine, fine. Okay. Yeah. Once everybody logged in, then we'll start. Yeah. Okay. Should I start? Okay. Good evening, everyone. Myself, Reena Frank. So I'm happy with the Society of Simulation Healthcare that providing me an opportunity to present like how to use a lesson plan in the simulation. So welcome you all for this webinar. If you have any doubts regarding a lesson plan, how to incorporate during a simulation teaching, you can either raise queries in the chat box or keep question and answer at the end of the session. So I'll be addressing those questions at the last. Give me a minute. I will share the slides. Okay. Is the slides are visible? I'm audible also, no? Okay, so let us move on how to incorporate the lesson plan in a simulation. So before we go for a lesson plan, I'll give you a just a brief idea what is simulation because I do not know the all the participant. Are you all doing a lesson plan in your like a simulation in your daily teaching or no? So just to give a little introduction about the simulation, what it is and how we have to plan. So simulation is it is a teaching technique. It is not a specific technology because many a times people are scared to go for a simulation as a facilitator. Why? Because I have seen like many will tell like we do not know how to use the software like all the muse all those things we don't know, so it is like they are little scared, they are hesitant to go for a simulation teaching. But once you are using techniques or once you know how to use the techniques, then the simulation becomes easy. Why? Because it is nothing but it is a created and guided experience which mimics the real world process or a condition to achieve the educational goal. what we are doing or what we are showing in the ward for a student, same thing we are mimicking the simulation. Then why simulation? You might think if it is the same from a clinical, why it is a simulation? Nothing but in simulation on patients, certain experiments we cannot do it because which may harm for a patient. Whereas in a simulation, when you are taking a learners and teaching there, leave the student to play around with the mannequins. When they do the wrong things on the mannequin, you just deteriorate the mannequin. If they still will not do a good things on the mannequins, you just make the mannequin to die. Take them to a debrief and then explain what went on well and what they could improve. So students understand what they did is may not be good, so they have to improve. For that they have to learn other strategies, so therefore they will improve their skills, what has to be inculcated in the simulation, so that once they know what went wrong in the simulation, they will never do the same mistake in the bedside. So therefore we can minimize the errors by doing the wrong things in a simulation, letting students to do. When we talk about a experiential learning cycle, which is given by calls, so we can call it as a calls learning cycle also. What calls says is from the concrete experience, that is nothing but by doing in the ward sectors or by seeing scenarios in the wards, like when other seniors are doing or doctors are doing, the junior will learn by seeing. But when you take the same group for a simulation, when you ask them to do, they may be thinking that I know I will do it. Allow them to do it. So what happens? They might do some mistake. Why? So far they have only seen. Now by seeing they are doing. So they are reflecting their experience what they have done. So what happens when they do wrong things here? They learn what is right to do. So that is nothing but abstract conceptualization. That means they are concluding how to learn from the experience, from their own experience by doing mistakes. They will learn how to correct it themselves. So when you put the same student back to a right, now they know what went wrong in the simulation, so they never do such a mistake. So therefore, actual experimentation will start to implement the real things in the actual setting. So therefore, you can minimize the errors. This is nothing but the experiential learning. So as I told,
Ma'am,
it is nothing
ma'am,
but we
sorry,
are
ma'am. Ma'am, your
yes.
slides are not moving, ma'am. It's in the initial slide itself.
Slides are not moving.
Ma'am, put it in slideshow mode, ma'am.
Yeah, it is once again. I will reshare the slides. Is it visible now, slides?
No, ma'am.
No. Once again. Is it visible?
It's coming up,
Yes, ma'am.
but it is not in slideshow
These
mode.
slides are changing.
Slides are changing, but not in slideshow mode.
Yeah, no, slides. So I did not put. I just wanted to know whether it is moving or no.
It's okay.
Yes,
Yeah.
ma'am.
Now, these slides are moving.
No, ma'am.
These slides are moving so that I can
Yes, ma'am.
continue.
Not moving, not moving.
Yes. It's not moving. No, I put in the slideshow only, but when I go for a slideshow, it is not moving. Now it is moving, right?
Yes, ma'am.
Yes, ma'am. Yeah.
Yeah, but the moment I put it for slideshow, it is not moving.
Yeah.
Yes. Now is the slides are moving. Okay. Now is it moving? Now slides are changing?
No, ma'am, not changing.
Okay. Now?
No.
No.
Uh,
Okay.
Madam, please make
Yeah.
it a slideshow.
Slideshow only it is
Slideshow.
there. It is in slideshow only. I am seeing a slideshow only.
Madam, you have to share the full screen. If you share only PowerPoint, then it is problem.
I think we have
Now
to
tell
share
me.
the screen, Reena.
Yeah.
Share the screen.
Madam, please press key F5.
Yes,
F5.
yes,
Yeah.
madam.
Now is it visible?
Yes, madam.
Yes, yes.
Now it's visible, no? Okay. Now slides are visible, no, sir?
Yes, yes, visible.
Yeah, visible, visible.
Okay. Visible, no? Okay. So we have seen, I was explaining what is experiential learning cycle. So this is what the cycle looks like. Okay. Concrete experience, nothing but what the learner has knowledge from the board setting. Reflective observation is after seeing, student will do it in the simulation lab or the skill lab, thinking that how much students know. Next is abstract conceptualization, nothing but ask the student to do. When student does wrong, student will realize what went wrong. So therefore, student will learn out of experience. And then when the student is put forward to the word setting, student will not do such mistakes. Okay, that is what is the experiential learning cycle. So simulation is nothing but it is providing the immersive learning experience and which connects the theory to practice. Okay, so you can see in the first image, before taking to a students to a simulation lab, we have to give a knowledge or on the what topic you are taking. That class has to be taken by in the class setting. It can be in any way. You can show a role play, you can do a didactic class, you can show the PowerPoint, you can show the video, any method you show it, but class has to be taken. Student must gain knowledge before coming to a simulation lab. Once done, put them into the simulation lab and show them what is exactly they're supposed to do it. That is nothing but we are putting a into a immersive theory into a practice. So when we talk about a simulation, the few words comes, that is fidelity, knowledge, all those things, so that we need to know what it is. Fidelity is nothing but it is a simulation element, because when students are doing in any scenarios, when we run in the simulation lab, we cannot mimic sometimes 100% as it is from the word, but you cannot say like if it is a simple injection, now imagine you want to show a simple injection technique for a student, that is also IV injection technique. So you don't have a tourniquet, you are holding hand of a patient and telling, now imagine I have done tourniquet. So there is no imagine. So actual things what it has to resemble, the same thing it has to be there. If you want a tourniquet should be there in the lab. So that is what I meant is fidelity. So it is nothing but it is a situation or action or the object what need to be there to resemble the real life, that has to be present in the lab. so that student know when it is going back to the actual ward setting. So what are the things and what she is supposed to do. The fidelity is reality, how much reality you are bringing in your simulation. So if you see the elements of fidelity, first one is always the equipment or the physical. You can see here in the picture, the student is giving CPR. So physically, she is doing the task. That is what is physical. Student supposed to do it. No telling you assume, all those things should not be done. Second one is a task. You cannot say you act like pricking injection, whereas in this mannequin you cannot prick. No. If you want to show IM injection, student supposed to flick to a patient or a simulator. So that is the task. The student must do the task. Third one is the environment. If you see in the same image, the moment you see the picture, you don't look like, it doesn't look like we are doing it in the simulation lab. It really looks like somewhere it is taken, like actual scenario is taking place at the bedside. You can see the doctor is there, nurse is there, like class 4 worker is there who came for assisting. Like actually what's supposed to be done, that environment is created. So that is what we have to create even in the simulation lab for the student. Last one is a psychology. Whenever we do something in the like a simulation like MCH labs or in your foundation lab or in the classroom, what happens the moment we tell the students you act something, the seriousness will not be there. We never think it is a reality. But when you take a student for a simulation classes, the psychology of yours and student should be apt. Like they should not think like, you know, I was not knowing it is actual setting. If I knew, I could have done. Those things should not come out from the student. So therefore, actual psychology also should be seen. Now, if you see in this picture, everybody is serious, from the student, from the class 4 worker. Everyone is busy in their task. That is what meant fidelity is. And that should be present. So when we talk about simulation, there are so many modalities in the simulation. That is part task trainers, you have a patient simulator, we have a computer-based simulator, we have a virtual reality haptics. So any method you can use based on your scenario, what you want to show for a student. It can be a low-tech mannequin, it can be a high-tech mannequin. It can be only a part task trainer. If you want to do a part task trainer and you want to see how the student is communicating with the patient, go for a hybrid simulation. What is hybrid? You can keep a small IV arm and make someone to sit there. So when the patient is, when the student is trying on the patient tourniquet, if it is not explained, the person who is acting like a patient can talk. Sister, what are you doing? Or madam, what are you doing? So ask. That time student realize I did not explain procedure to the patient. Likewise, innovative way by using any of the modalities, you can bring into a picture of the realism. So bring it as it is realism. So these are the part task trainers. What I meant hybrid is this picture. See, the one person is pricking for a patient, collecting a blood. We had made one person to sit so that whatever person who is collecting the blood want to explain, she is explaining to a hybrid person. Okay, even the low tech mannequins we can use and we can teach from our class 4 workers till the doctors. Like how to ship the patient, what is the body mechanics for anybody, any simulators we can use for anything teaching. But only thing is how you are using it based on what you planned. Next comes is the high fidelity mannequins. High fidelity mannequins, you all know that they are actually mimicking how the patient mimics or how the patient does. In the high fidelity mannequins, mannequin will act, mannequin will talk, mannequin will have the pulse, mannequin will have a heart rate. If you connect to the SpO2, it will show SpO2. If you connect for ECG, it will show the ECG leads. So it is resembling as it is a human being, but you need to address the student or you need to show to the student before you start the scenario, what are the things the mannequin is able to do. So therefore student know what can be done. But when you do in the high fidelity simulators, we have to prepare. That is nothing but setting. When you're preparing, see that all the things are there along with the simulator. Next, the number of a people, that is student, facilitator, and your time allocated. Your time allocated, if it is a 45 minutes, you are taking a 2 minutes for pre-brief, when 5 or 10 minutes you are running for a scenario, and the major part, that is 45 minutes, where the actual learning will takes place. That is for the high fidelity mannequins. You can all can also do it for an in situ simulation. In situ is nothing but the mannequins or the part task trainer. We are taking directly into a ward system, okay, or the actual setting, and we are showing these can be done to see what are the system errors into a practice. Okay, this is actually a very good method to implement so that we all will know what is a system error in our practice. Okay, this is in situ hybrid because we want to collect the blood. She is using a part test trainer, but actual patient is sitting to reply for her. And the standardized patient. Standardized patient is nothing but we are making a one person as a to give a history to the student. If the student want to do auscultation or to collect the history, sometimes one patient will not give a history if it is a rare condition for all the students. In such cases, you can use a standardized patient or the simulated patient. So just now in the pictures, we might have seen there one amputated patient was there. PPH mother is bleeding. So how these all things we can use to how to bring the realism. So we can use a mollage. So what is mollage? Mollage is nothing but it is a technique which is used to simulate injury or a disease, aging. Like if you want to show a PPH, now real blood you cannot pour over in the simulators. So you are putting a mollage and showing that mother is bleeding. That is what mollage is. So if you see the picture, it will show you the realism. You can see in the first image the crush injury. If you see the bones and all is visible, it is nothing but made with the mollage. If you want to see a scar burns, if the mother is bleeding for PPH, okay, so use the props, use the mollage and make the scenario realism so that now student will feel it is real. Otherwise, the realism will never come in the picture. Okay, so how the simulation cycle? Simulation cycle is nothing but we have to prepare. That is a facilitator role. Prepare what? Scenario has to be prepared or skill has to be prepared. For whom are you doing? So prepare. So lesson plans comes in the preparation stage. Then once the lesson plan is prepared, you are prepared for yourself, you have prepared for the students. Take the students to a simulation room or the skill lab and you give a brief for the student. Means what you are going to do. Then you put the student in a scenario, ask them to perform a task. Once the task is done, take the student back to a debrief and go through what went well and what could be improved. That time that is actual learning takes place. So student will reflect so many things. Now they understood what went is wrong, what could be done, they understood. So put them back again to the same scenario, they will do better. Then evaluate the students. Always remember when you pre-brief the students, okay, when you pre-brief the students, we have to explain the ground rules and fiction contact. Why? Because if you don't tell them what are the ground rules, they will not be serious, especially the confidentiality. Whatever happens, discussion or whatever practice happens, we need to tell our students it will be confidential and it will retain only in the simulation lab. Whatever happens, sometimes students will not do things even though they know. Why? Because once they go out, other their companions or the teacher will tell that you did not know. So that's why maintain a confidentiality. No taking a photograph or a videograph in the simulation. In case if you are doing a research and if you want to take some photograph or videography, take the consent from the learners or the students. Then only you are supposed to do it. But don't forget to explain the fiction contact. What is fiction contact? It is nothing but at the end of the scenario, students should not say, if I knew this is real, I wouldn't have done this. Mean student know this is not real. That's why by knowing he does mistake. So we also know, student also know, learner also know it is not real. So therefore, let us tell the students whatever happens here is not a real, but let us assume it is a real because it is a mannequin, but we assume it is a real and we'll do it. So that friction contact will be removed from the student mind so that they think whatever happens, it is in the realism. So debrief, I told you, debrief you have to ask. Majority we can go for a plus delta model. Ask the students what went on well and what could be improved. So I'm not touching this part much. What is debrief and feedback? Just to tell you what is the difference between debrief and feedback. Feedback is nothing but we are using for a skill. It is one-to-one person we are giving a feedback. Whereas debrief is for a scenarios. For the entire group of a student, we are, after running the scenario, we are making them to sit in a one classroom and then we are going through for every student what went on well and what could be improved. So actual learning takes place in the debrief. Moving on to our lesson plan. So before we start lesson plan, we must know what are the specific learning objectives, because in the lesson plan we are going to prepare a specific learning objective. So SLOs are nothing but these are a expected result from a student out of a one scenario or from the skill. What behavior you are expecting from the student or from your performer, that is your SLO. Okay, so the lesson plan should have learning expectation from the student. So what you are expecting from the student, what materials you are using for your particular class, and what teacher checks of understanding of the concept. All these three things is merged together is called as lesson plan. Then how the lesson plan looks like. This is the template of Father Muller College of Nursing, what we do it in our simulation lab. This is for us same in the simulation lab for everybody, all the discipline, even the doctors, nurses, we are using the same lesson plan for all the skills. Lesson plan is important for the skills as well as scenario. For scenario, along with the lesson plan, we have to prepare a SCE also. But whereas for the skills, only a lesson plan is enough. Now let us see how the lesson plan is. Again, your lesson plan need not to be as it is ours. Like we are also referred from other lesson plans and we have put up one schedule now for us. So you also can see our lesson plan or other templates and you can modify as you want. Okay, lesson plan can be modified. So in our lesson plan, the first component is competency. What is competency? Competency is nothing but out of your class, particular class in the simulation lab, what you want to do for students or what you are expecting from students to do it. Here, we planned a pediatric station that is nothing but CPR. So here our competency is students gain competency in pediatric resuscitation skill. Be firm what you want from your student. Next comes the domain of learning. So when we talk about domains of learning, we all know there are three domains, that is nothing but knowledge, psychomotor, and attitude. We always add communication because nowadays there are so many problems happens because of communication. So add a communication as a one component. Okay, then you can write in every part, every element, what is knowledge, what you want students to know knowledge wise. So in this lesson plan, it identifies and describes the pediatric resuscitation. I want to know, students should to know what is pediatric resuscitation. In psychomotor, I want my students to skillfully providing CPR and breath using arm bag. What is attitude? I want student must be confident at the end of the skills. What is communication? Here student will identify that baby is in a risk and want a CPR and she reports. Okay, that is what is the domains of learning. Next, moving on to the proficiency level. In proficiency, that is from the novice to the expert. So from knows till does. Knows is always base, nothing but theory. Already class is done, so student will be know the theory. Knows how? When you demonstrate, student will know how to do it. Shows how, students is able to demonstrate you back. But does is the component which we cannot do it in the simulation. Does is always in the bedside. Student does with the confidence where in the real setting. So in the simulation lab, we can expect from the student knows how and shows how. Student will know the theory, student will show us and student know how to do it. That is what is possible in the lab. So mention what you want from the student. If you want student to show you, then write show how. If you want student only knowing is enough, then knows how. So based on you, what you want expected from the student. Next come a very important concept, that is SLO. I already told SLO plays an important role. That is nothing but what you want to teach or what is expected behavior of a student at the end of the class. When you use a SLOs, always remember it has to be used or it has to be written by using a ABCD technique. Now what is ABCD? A is nothing but audience. Audience is which group of students you are taking. If is a MBBS, okay? If it is MBBS students, in MBBS again we have so many terms, first term, second term, first phase, second. So whom you are taking, specify, maybe MBBS first term or a first batch, whoever it is. Next comes B, that is a behavior. What you want students to learn or what is the outcome behavior of the students at the end of the learning. Here I want to know at the end, student will provide an effective chest compression and breaths. That is what behavior I expected from my student. Next is a C. C is nothing but condition. In which condition you are going to do it, whether it is in a simulation lab, whether it is in the skill lab, whether it is by using a low fidelity mannequin, whether it is using a high fidelity mannequin. Okay, that is nothing but condition. And the last one is D. D is for degree. Like in what accuracy you want students to do, whether it is 80%, whether it is 90% or 100%. If it is a cannula insertion, by putting cannula in the lab, student might be doing, but 90% student does correctly, it is enough for me because 100% sometimes may not be possible. But in case if you are doing a CPR and if you are asking the student to do CPR, then I want 100% because CPR student must learn all the skills. If the student does not know how to do it for dummy, then in the real patient student will never do it. So therefore your accuracy remains 100%. Okay, so that is based on what task you are taking. Depending on that, you can do it. So here the SLO is by using a ABCD technique. At the end of the session, MSc nursing student will be able to provide effective chest compressions and breath in the children or a child who need a resuscitation using a mannequin by using 100% accuracy with the confidence. That is what my SLO is. Next comes component is setting where you want to do. So we do it usually in the sim center. Next is the resources are required. Means whatever resources are required, you have to list it well in advance. And that is whether it is a real patient, whether it is a simulated patient, whether it is a microscope or a slides, or whether it is a part task trainer, whether it is a VR. Okay, which technique you are using, that we have to write. So here what we use is a mannequin, that is high fidelity sim. What are the other things is required? Ambu bag is required. I want a facilitator guide as a facilitator. I want two facilitator, one to see the students, one to run the scenario, and I want a crash pad. Okay, these are the things what we want to run a CPR. Moving on to the continuation of a lesson plan. Next component is how the students acquire the knowledge. As I told you, before taking the students to our lab, we have to finish the theory part. So how the student acquired the knowledge? It could be any method, maybe a learning teaching method. How the teaching, maybe a lecture, seminar, video, guidelines, you might have given algorithms or you might have given some handouts. Okay, in any way, what way you taught the student, you just mention here. Next comes the facilitator guide. To teach that either in the class or in the bedside, what method you adopted. Okay, what method you adopted. Usually, if you are a doctor, usually doctors are using either OMP or SNAP. Okay, what is OMP? That is a 1 minute preceptor or a SNAP that usually used by a physicians, clinicians. Whereas we as a nurses, we are using a dope method or a patents method. Dope method is nothing but that is a we are demonstrating, observing from the student, we are asking the student to do and we are assisting and the student is actually performing. That is nothing but dope. Other method is a patents model. Patents model is a 4 steps model. So what happens here? The first step is the demonstration. Here teacher demonstrate, learners see without talking. Okay, that is a demonstration. Second one is the deconstruction. Here now teacher shows how. Teacher will every step deconstruct. Student will learn how to do it. Okay, teacher does by explaining. Student listen and learns how to do it. Next one is a comprehension. Comprehension is nothing but now learner does by describing the steps. And at last is a performance. So learners shows how to do it. So that is nothing but the patents model. So you can use anyone. And for the communication, we can use the Kalamazoo or the S-bar technique. Okay, any method. You can write whatever you want here, but while writing the answer, which method you want to assess, only one you have to write. Then, how are you going to assess the student? Are you going to keep the pre-test? Are you going to keep the checklist? Are you giving the post-test or you want to conduct some quiz? So mention here, this is a facilitator guide. So how you are running the scenario, therefore mention whether you are going to do a quiz, pre-test, post-test or using a checklist. In the student guide, when the student coming to a simulation lab, student must know whether student is undergoing for assessment or you are called student to teach. If it is assessment, if it is questionnaires are there, class has to be taken, student should have knowledge. Then only you are supposed to give a pre-test. If it is only pre-test doing and teaching, fine. If you want to assess the student, then we have to prepare a checklist. Once we prepare a checklist, students should go through that checklist before coming to the simulation lab. Student must know how the facilitator is evaluating the student. So the same checklist, student should have one copy so that bias can be minimized. At the last, how the teacher is evaluating, whether it is for evaluation for the facilitators or for students. It could be vice versa, both. Like first time one facilitator is doing, how that facilitator is doing. So facilitator also can be evaluated, student also can be evaluated. Okay, so we have to prepare a student guide. Next one is an assessment plan. How I'm going to assess the student, whether it is a formative or it can be a summative. Summative is nothing but at the end of the year you are going to assess the student. If it is a formative, ongoing, whenever student does with the checklist, we are assessing the student and putting the marks. Okay, it is based on how you are planning. It can be summative, it can be formative by using a MCQ, short answer, OSCE, OSPE, DOPS, any method. That is up to you, whichever teaching learning methods you are adopting, any method. But this is what we do it in the Father Mullahs. This is our template. As I told you in the template, we have a facilitator guide. I have given little more description here just to understand what and all should be there in the facilitator guide. So facilitator is nothing but the teacher who is going to run that scenario. Okay, the person who runs the scenario. We don't call it as a teacher, we call it as a facilitator. Our role changes here. So we need to prepare the lesson plan. We have to be familiarized with the lesson plan. Once the lesson plan is done, we have to go to simulation lab or skill lab, arrange the things. Before student coming into a simulation lab, the venue should be prepared. If you want to do a CPR, when students are entering, they should look like someone is suffering with the cardiac arrest. Okay, then that realism will come. So arrange the simulation lab with all the resources. Well in advance, inform the students at what time to come, who has to come. Arrange the group of a student and your time. Time should be allocated first only. It should not be more than 45 minutes. If you run the scenario more than 45 minutes, student will lose the interest. So in this lesson plan, what we have discussed, our goal was learner should be able to perform the CPR with the chest compression. But that was a broad SLO. But for a teacher, or for a facilitator, we should know how to split that objectives. Okay, so you can use a specific objective. This is for us to know what and all I am going to assess. Since it was a CPR based on a AHA criteria protocol and kept what we are going to do it. Okay, this is how the lesson plan looks like. Okay, so the lesson plan is required for every skill. I hope every one of you understood what is lesson plan and how to prepare. So let us move on how to prepare a simulation storyboard. If you are doing for a high fidelity mannequins, if you are doing any scenarios, then we have to create a storyboard. So how to create a storyboard for a high fidelity mannequins or a high fidelity simulation. So whenever we are talking about high fidelity simulation, there are mainly three phases. First phase is the planning and pre-briefing. We need to plan what is the scenario and we have to pre-brief the student. Second phase is we have to run the scenario, that is nothing but implementing the scenario. And third one is once implemented, we are doing a debriefing or a evaluation, like how it went on. In a first stage, what and all we have to do, that is a phase one. That is name the simulation, like PPH scenario, eclampsia scenario, or cardiac scenario. Okay, name the simulation. Then develop the SLO. SLO is nothing but just now we have seen in the lesson plan how to develop a SLO using a ABCD technique. The necessary supplies or the equipments or the resources, whatever is required, all those things we have to mention in the lesson plan or in the SCE in our template. What is required and write a script, nothing but a storyboard. How to write, I will show you our format so that you will understand what could be added over there. Second step, once the preparation stage is over, running the scenario. Third phase, debriefing and evaluating the students. So your scenario when we are developing, this is the rough template. If you search in the Google or if you go for any SEs and all, you will get in the simulation, there are so many templates. Any one template you can adopt with their copyright, or else you can take that, you can modify it based on your simulation setting. So this is template which we are using it. That is scenario name. There should be name, date, institution, target audience, what is the goal. Then we have to create a learning objectives, clinical case information, student preparation, and this all these things. I will show you our template so that you will understand in a better way. Okay. So this is full template. If you go for any online basis, I told you will get so many templates. So this is the other template. I'm showing you only the templates. Those are available. This template is from the training of healthcare simulation community. Likewise, you will get for a different. There are so many templates. Okay. So this is how the high fidelity mannequin scenario will run. As I told you, initially the pre-brief. Take the student to a pre-brief room. You explain them what is expected out of them. Okay, what your expectation is. Put them into a simulation room, orient the mannequin, ask them to do auscultation or anything, whatever they want to explore, let them explore. Give them 2 minutes because they should know what is possible in that mannequins. When they do not know what is possible, they will not perform. So ask them to do all those things. Once the student is thorough with the mannequin, then you run the scenario. When you run the scenario, one facilitator is along with the student, one facilitator to run the scenario in the with the news or with the computer to run the scenario. Okay, students will be performing. Once the performation is done, you are taking them to the debrief. Then we will see what went on well, what could be improved. If required, again reflective learning can be done. Okay, so we will move on to our template, what we are using. This is the SCE template, what we are using in Fadamullah Simulation Center. In section 1, we have a scenario demographic. That is, what is the scenario title? Here I have taken PPH. Date of development, when you developed. Even in the lesson plan, I forgot to tell, the date should be at the top. Why we are mentioning date is, if you don't mention date, if I prepared it for maybe like this year, if I prepared, there is a chances that I will use that same lesson plan for another 10 years. There may be so many newer modalities are come, but I did not do it. That is why date is important to see whether as the year pass on, whether we have changed or any innovation is done or no. Okay, that's why the date is very important. Don't simply change the date and keep inside things the same. It should be always modified as the trend goes on. Okay. Then what is the target learners? It is third year BSc whom you are taking. You can write there. Okay, that is in the section 1. Section 2, who developed the scenario? So this is scenario is developed by me. Institution is Fadamullah College of Nursing. Your email ID you have to write because just to know who developed it. If you want to change it tomorrow, you can change by putting your name. Next is section 3. That is a curriculum integration. How I'm going to integrate this into a curriculum. And that is nothing but my learning goals and objective. So your educational goal is I have taken PPH. So therefore at the end of the session, student will gain knowledge of PPH and how to manage it. Okay, what is the crisis sources? Student will be able to identify PPH timely and do the management. That is what is the SLO. What is the clinical objective? Students will be able to control the bleeding. That is what I want. Student immediately should control the bleeding or else mother might go for a shock later. So therefore my intention, student need to control the bleeding. Next comes a case summary. Now in the case summary, we have to write everything, how the case look like. Okay, what case we are doing there, that brief introduction has to be written. So major events, what you have put it in the picture, those has to be described here. Okay, I'm not going to read. I hope you understand. Like major case summary is nothing but a brief summary about the case. Next comes the vignette. Next comes the reference. From which book you referred or what you want your student to refer. Since it is OBG and PPH, I want my students to refer DC Datta. That's enough for me. Okay, if you have any other references, if it is for the MBBS or if any postgraduate, if you want to put out more references, you can put which references you want to put, that can be done. Next comes the section 4, that is the scenario script. Here scenario script is, I told you we are pre-briefing the student. So when the student is coming to the simulation center, we are reading loudly the scenario for student. That is nothing but the clinical vignette. So previous slide I showed you the summary. In the summary we are writing detail, but whereas in the clinical vignette we are not writing detail, but what is necessary for the student to know, that much we are telling here. Okay, how the patient is, when the patient deliver, and now we are waiting for what. Okay, here you can see Patient is delivered already, baby is out immediately after the birth and handed over to pediatrician. But after the delivery, vitals were assessed and found they are as follows. You can see a temperature. Pulse is for the higher hand. Why? Because maybe mother is moving towards PPH. So pulse is in the higher end. Mother is drowsy. Mother is on oxytocin. NS is on flow and uterus is not palpable. So student must understand when you say BP is up, mother is drowsy, and the uterus is not palpable. That means abdomen is soft, means uterus is not contracting, atonic. Okay, so PPH they should be able to identify. In the scenario, what is the scenario? Cast and realism. So here, for patient whom you are doing, here who is your patient? In the simulation, we are using a mannequins. So which type of mannequin you want to use? Whether it is a computer mannequin, whether it is a simple low fidelity mannequin, you want to use a standardized patient, hybrid or task trainer. Since it is a PPH, I used here select most important dimension, okay, which one you want to do it. So we usually do it in a high fidelity mannequin. So you have to only tick here high fidelity mannequin. What is your concept? Whether physically you are doing, emotional, or if it is anything others, okay, task trainer, you have to just tick. So your template in such a way, what and all you want to write, you have to put there, and which mannequin you are using on that day, you have to only tick. Confident, that is a brief description of the role. Whom and all you want? I want in this PPH junior nurse, there should be a senior nurse, there should be junior resident, senior resident, and one staff. And when people are shouting for help, other 1, 2, 3 staff nurses to help. At the most 5, 6 people are there is enough. If it is too much crowd, they will not do it anything. Then what are the required monitor for you to run the PPH? Whether you want ECG lead, NIBP monitor, pulse oximeter, gloves, stethoscope, DFib, all those things written, what is required only, you put a tick mark, because this template is for all the scenarios. But every scenario differs with the resources. So what you require, you have to just tick based on the scenario. Okay, next is the drugs. What are the drugs we are keeping? So since this is a PPH, I kept oxytocin, carbopress, methogen, misoprostol. If it is a preeclampsia, you can change the drugs. You can keep a magnesium sulfate, or you can a labetalol, depi, whatever you want, okay, based on the condition. Molage, yes, I want to molage, because when I cannot say when there is a no blood, the mother is delivered, I cannot say mother is undergoing for PPH. That should be a realism. Therefore, use a molage. There should be a lot of bleed. Okay, so the student must understand that mother is really bleeding. I should do something. Appropriate time for me to set up, I required a 15 minutes, scenario to run 15 minutes, and debrief is for half an hour, because debrief is the main thing where students are learning at the maximum. Next one is the patient data and baseline state. So this is how we are writing the patient full data. Okay, just a brief summary of the patient, age of the patient, gender, what is obstetric score, whether primary, multi, G2, P1, L1, okay, LMP, EDD, period of gestation, chief complaints, history, okay, all those things, whether she's allergic, is there any social history, family history. Baseline simulator, next is the physical examination. When you do physical examination, how was the reading? Okay, right there. What is the reading? What was the heart rate, temperature, how the patients look like? Okay, I have kept the patient here drowsy because patient is undergoing for PPH. Kept heart rate little higher thing. Okay, glucose is normal. As you want, you can modify it. Scenario state. This is a very important. As the student perform PPH, now here we have to write and give. One is a learner action, modifiers and triggers. So when stage we are giving for a student, learner should know what to do. Immediately when you say PPH, student might give a oxytocin. If the oxytocin is given, bleeding maybe at least should reduce. Or if you don't want to reduce, if the adequate amount is not given, you trigger the patient. Okay, the moment triggers, maybe BP is again falling down, mother is more bleeding, or mother is becoming more drowsy. That means condition is worsening. So here what is the outcome? Now I want students to do along with the PPH ABC protocol, because patient is drowsy, patient might collapse anytime. So here modifies what and all. Now you want ABC means you want airway, breathing, circulation along with the drugs. If again student is not using all these things, you again trigger the patient. You again worsen the patient. What is your learning outcome? Likewise, you have to go on, put 1, 3, 4 learning and then triggering the patient. In case student does what you want, then you have to improve the patient. Okay. Next one is the last section, that is a supporting document, laboratory results and the multimedia. If anything, if you want a laboratory result, if you want student to send for a grouping HB, because student here the case is PPH. In that case, I want student to send for HB grouping cross matching, because to give blood I want cross matching. Before that I should know what is the HB also immediately. And if you want any images, since it is a PPH, I don't want here any images. Okay. So if you want a ABG, ultrasound, you write whatever you want, you write, so that student is, it is expected from the student to do. And student can ask what is the grouping, so the facilitator can tell grouping is a O positive. Likewise, if the student is asking, we can reply for the student. This is what how our SCE looks like. So we dealt, if we are using for our skills, we have to use a lesson plan alone. If it is a scenario, in that case we have to prepare the SCE module. This is the template, okay, for the scenarios, and we have to use the lesson plan. Why these both are important? Because in case I have scheduled a class in a simulation lab and that day I am absent, but simulation class cannot be rescheduled. In such case, my any companion can come and take class by seeing a lesson plan, because lesson plan is a roadmap for anyone, because everything is written over there. What is expected from the student, what student must do, everything is written. So therefore, it is a roadmap for anyone who is free that day to do it. So this is how a lesson plan and SCE look like. So if you have any doubts, now we can address the doubts, question answers. Is there any questions? Any doubts to ask?
Ma'am, I don't get the last point. If it is a skill alone, you prepare a lesson
If
plan.
it is a skill alone, the lesson plan is enough. Like
Okay.
IV cannulization, only CPR. Okay, those are the skills.
Okay.
Only lesson plan is enough for that. If
Okay.
you are doing a scenarios like a cardiac arrest, MI, preeclampsia, eclampsia, trauma, asthma, like condition you are doing scenario, in such cases, the scenario template is required. And
Okay.
along with that, lesson plan is must for everything.
Okay, ma'am.
both
Okay.
both is required, because we need to see how the student is doing. No, if the student is not doing, you have to trigger. If the student is doing correctly, then you have to improve the patient.
Okay, ma'am. Thank you, ma'am.
Good evening, ma'am. It is a very good and detailed presentation. I'm Dr. Jayshi here. One
Yeah,
thing is, are you introducing simulation scenario for your undergraduate students also, ma'am?
yes ma'am, we are doing for undergraduates also, even for nursing, even for MBBS we are doing scenarios.
Okay, so we are planning for interprofessional this thing you're doing it, ma'am, for your this thing. All these
Yes,
scenarios will be good.
actually interprofessional is a very good weightage. Why? Because nurses role nurse only will play, doctors role doctor only will play. So that time when they go for a real setting, they know who does what. That becomes easier.
Yes. Mm. So you does interprofessional, ma'am, for all these scenarios, or first you do it separately the skills and then you bring them for the scenario, or you bring them to the scenario directly?
No, we have the skills separate, scenario separate. The skills like a palpation and all, no, only if it is antenatal palpation, we are showing in our MCH
Oh,
lab. We are not bringing them to a simulation lab, because some certain mannequins we have in our normal college level. So we do it over there only. If it is a scenario, what are things are not possible to do in the lab. So we are bringing them to
okay.
the simulation lab, which is easy for them because they learn in a better way in the simulation lab.
Thank you, ma'am.
So
Hello.
we have training for graduate students, already graduate doctors who undergo 1 year training program in emergency medical services.
Okay.
We haven't yet started simulation training for graduate students. We have a medical
Okay.
college as well at Pune.
Uh,
So we
Okay.
use the part task trainers and hybrid
Okay.
models for
Okay.
the clinical skills, as
Okay.
mentioned, intravenous catheterization, etc. but the
Mm.
scenarios are used for doctors who are working in ICU setup, casualty setup, so that they undergo those critical 10-minute scenario where they need to handle the emergency situations, various
Okay.
bradyarrhythmias, etc. Now,
Yeah.
regarding the lesson plans, we
Okay.
face a challenge about to prepare the scenarios, different scenarios with different
Yeah.
pathological conditions. And like you mentioned, the lesson plans need to be done. So we have few faculties who are trained, who have the adequate knowledge to run a
Okay.
scenario. But
Yeah.
we face challenges in debriefing of the students, how to
Mm.
make them debrief about, and how to get a scenario done. What are the interventions where a facilitator needs to intervene and when he does not need to intervene. The basic idea
Yes.
of simulation is that the learners make mistakes on the
Yes.
simulation mannequin, high fidelity
Yes.
simulation, and they self
Yes.
reflect and learn more things rather than the teacher saying it that this is the right way and this is the wrong way.
Yes. They should
So
realize
my
it.
question, yeah, so this is the challenge. How can we overcome it, or is it just by practice, or we need to go some certification courses or training programs? What would you recommend?
Like for simulation, if you all have like a basic training, if you're undergone or in your own faculty, somebody is teaching for you, it is well and good because even for us, initially when a simulation lab came up, even we were so reluctant to go for a simulation because we did not had any idea of like how to run in the simulation lab. We were also thinking like we have a MCH lab, we have other labs, we can do it here. What is the difference doing in the simulation lab and over there? But actually, once in the simulation lab you're taking, we know now learning is entirely different because here we are facilitating the students. So student will learn by doing the mistakes. So therefore, the facilitator role is a major role. You should know how to run the scenario. Therefore, it is better to go for some basic classes for a simulation. It need not be a certification course. Those who are like who is already gone for a set like a course, as you told, like you have a 1 year program, so they can teach who does not know. So by doing along with them you can learn.
Sure, ma'am. Thank you. And
Lesson plan is a must. Okay, lesson plan need to have there because if the lesson plan is there, then even though you are not free, no, someone else can run that scenario. And that one lesson plan you can take it at least for that whole year. That lesson plan can be used each time. You need not to write a lesson plan for the same setting or for the same scenario.
thank you, ma'am. Thank you so much. Would you recommend some certification that has a training program for the faculties?
There are nowadays like that pedestas, and then like other some of the societies, they are giving a certification course. If you want to do a certification course, well and good, you can do it. So that there we are learning so much like how the simulation classes has to be taken, what we need to prepare, what is the facilitator role, everything we are studying in detail. If you do that, it is good, but I'm not telling it is what like compulsory. That is up to you, doing or not.
Sure,
Because
sure, ma'am. Thank you, ma'am. Thank you.
yeah.
But the more you practice, the more you conduct sessions, that will be great. That will help you
Yes,
more.
yes,
That's what you are trying to
because it is
say.
every day is learning.
Right, ma'am.
By doing mistakes only we are learning. Correct.
Sure, ma'am. Thank you.
Okay.
Uh,
Okay. We do formative because summative because we have all the batches 100 in strength. So all 100 at the end of the year to take and do assessment, it's very difficult because we have for the entire institution one simulation lab where as a medical faculty, nursing faculty, everyone using the same lab. Therefore, we go for a formative assessment. Yeah. Part task trainer is like if you want to teach a student IV canalization, only arm will be kept, arm separate, entire body mannequin is not required. If you want to show them a catheterization, okay, only that pelvic part is enough. If you want to show the NG tubings, only the upper gastros, this one till the abdomen, that part is there enough. That each organ is called as your part task. Means,
Yeah, yeah,
yeah,
yeah. Good evening, madam. It was an excellent presentation. Really,
thank you,
it
ma'am.
was, yeah, very nice. It was. I just have some queries like, yeah, then as you mentioned, it can be a catheterization and I mean a CPR, or it can be a I mean, blood withdrawal or administration of drugs and all these things. But I mean, how do you create a lesson plan for scenarios like epilepsy, postpartum hemorrhage?
Ma'am, lesson plan is what I showed you just now, no? Like for resuscitation, I showed you lesson plan. In the lesson plan, what you're writing is what is the facilitated guide? What is you wanted from the student, okay? And what student is expected to learn, because knowledge has to be taken place. That class has to be finished. And if you're doing assessment, checklist has to be prepared. And then what are the resources? And with the your SLOs, that is the lesson plan. Whereas in SC, that is a scenario, your detailed scenario writing. What is their parameters, patient history, patient brief data, what are the resources, everything. Just now I showed you the full lesson plan, no? The SC template, no? So
Yeah,
all those
yeah,
things,
madam.
detailed scenario you're writing. Why? Because in that scenario, you know when the patient come, what is the reading, how is the patient, what is happened to the patient. Now you want student to do, if it is a trauma patient, you want a student to do first a bleeding control by using a HABCD protocol. So you are keeping all the resources. In case if the student is not using those protocol, you can queue them in between. Okay, even after giving cue for a student, if the student is not able to understand and continue the scenario, you deteriorate the patient. Little BP you reduce, so the student understand what student does is not adequate there. So they will think something to rush the fluid, putting bore needle cannulas. If student still does not know, you ask them, do you want to increase the BP by giving something? So the student will come to know, well, yeah, bore needle cannula I have to put and rush the fluid. Or the patient is still bleeding, patient might go for a shock, so immediately tourniquet or put a direct apply for the pressure. Okay, like that. So you have to write a full scenario. In that scenario, you have to write what are the modalities you want to improve and what student has to do to improve the modalities. If student does not to do, you have to trigger the patient. Like that, one, two, three modalities you have to put there ready. That is
Okay,
a
madam.
scenario.
Mhm. Yeah, I understand. And do we have any like you are talking about modules and all? I mean, do we have any guide book to guide us or something like that for the different thing, or it has to be made only by the faculty?
No, it is better to do it in the department. Like, see, for the PPH, there is a PPH protocol. So, everyone, what we are doing in the hospital by doctors, so the same protocol we also use by nurses. So, the same protocol we teach the students same protocol. So, you can keep same. If it is a if you want to a AHA protocol, you stick on to the AHA protocol. Your checklist should be on AHA protocol. Likewise, that decision should be from your department. Again, if when you're preparing a checklist, that should be finalized from your department, and the entire department should use the same checklist. If you are 5 members in the department, the 5 members cannot use the 5 checklists different. It has to be sat together, it has to be designed together, and it should be finalized in the department. And everyone
Yeah.
should use the same thing. And that same copy, it should be given well in advance students. So students should know in what methodology you are going to assess the student. Otherwise, you cannot do assessment on that.
So it can be like a institution based. I mean, there is no general guideline since it's a new mode of learning and teaching. There is no guideline as such. It
Yesterday's
can be,
protocol also you can use for the CPR that AHA is already given. No, AHA protocol is there. The same AHA protocol you can remain. For PPH, there is a
yeah,
PPH
yeah.
protocol.
I mean, already for whichever we have simulation, like whether it is a CPR or, as I told, I mean, blood withdrawal or
You can,
administration of
yes,
drugs,
you can develop.
catheterization, all these are there. But as I
Yeah.
listened when you were talking about this PPH and epilepsy and all these things are new. I mean, we have never been exposed to for a simulation model. That's why I asked.
Okay. Yeah, so that you can prepare it from the department wise now.
Okay, okay, madam. Thank you for the
Yeah.
excellent.
Thank you. Okay. No, OSCE also can be done because since you are already teaching, OSCE is nothing but you are keeping like the 2, 3 stations. No, in that way also you can observe the students. It is up to a facilitator how you want to assess the student.
Hello. Can you hear me? Hello.
Yeah, I can hear you. Yes, sir.
Yeah. Thank you, ma'am. Thank you for a good session. It's really a wonderful session.
Thank you, sir.
And I have two questions. One is in SL. Oh, in SLO, can you please explain about the PNC 1 second? So where it is, I want to confirm that whether my understanding is correct or not.
Okay, see, A is the audience whom you are doing. If it is a first year
Mm-hmm.
MABS, which term? Again, if they have group wise, the batch wise, if you have divided, whom are you taking? Okay, that is nothing but audience.
Mm-hmm.
B is behavior. What you want them at the end is a CPR. I want to do a exact CPR. Is it not? So that will be B, behavior, effective CPR technique. C is a condition where you are doing it, whether it is in the simulation lab, whether it is in your other than skill lab, we will have our departmental labs no, over there where you are doing it. And in what? Whether it is a low fidelity mannequin, whether it is a task trainer, whether it is a high fidelity mannequins, whether it is a hybrid, in which way? Okay, that is a condition.
Yeah.
D is nothing but the degree, like what accuracy you want at the end from a student. If it is a CPR, at least 95% to 100%. If it is a catheterization, maybe a 90% also is fine, 85 to 90, because while doing, they will learn in the better way.
Okay.
So that is based on the skill what you selected.
Okay. Got it. Thank you,
I
ma'am.
hope I cleared.
Yeah, it's clear. And one more thing, in the
Yes,
domain
sir.
chosen with the model T and L method, there are some short form you have given OMP, SNAPS, and DJP. Patents
Yeah.
model we know, and other three models we are not much aware. If it possible, you can share some like content related to that that could be helpful. Like,
Yeah. Sir, OMP is nothing but 1 minute preceptorship. You are taking the student to the bedside, you are giving them 1 minute, you are leaving the student to discuss the case and you are going and giving them 1 minute. In that 1 minute, you are asking them to like actually OMP is total 10 minutes you are giving, but in the last 1 minute, no, you are asking them what went, like what scenario is. So they will tell the most of the things, what exactly is the preferential diagnosis
okay,
and what has to be done. That is OMP model. I think if you put OMP model, no, you will get that answer. There are so many literature what gives OMPs, and majority
okay,
of our clinicians are using a OMP method itself.
hmm,
And
okay,
that SNAP method is that is again a learner centers model. That is which is done at the bedside. So first you are asking the student to summarize the full history of the student patient. Okay, that is detail, but summary. But then after that you are going to narrow down the differential diagnosis. Then you are analyzing the differential diagnosis. Then you are giving a probe for the preceptor. Like it could be what finalizing. Okay, narrowing down. Once it is narrowed down, what is the patient condition? You are planning for management, and then you are selecting the case related issues. What are the issues over that patient? That is nothing but SNAP. Usually the SNAP and OMP is used in the clinical setting.
okay.
Excuse me, madam. I'm sorry. Can we have your email for any clarification in future? We can contact you.
Yeah, ma'am, surely. Should I put it in the chat box there?
Okay, madam. Thank you.
Thank you, ma'am. Thank you for your
Yeah,
clarification.
yeah. Email ID, I put it in the chat box, okay? Yeah, this is the lesson plan is of our father mullahs, okay? You can always modify it. If you want to use the same one, you can give us the copyright and you can use. We don't have any issues. But this is what we developed. Just now what I showed, no? I will share it later with the SHS group. Yeah. Any queries?